Good afternoon. Thank you for joining me and Monroe County Public Health Commissioner Dr. Mendoza for this week's COVID update. Before I start today's briefing, I need to say thank you to our teams at the Monroe County Department of Public Health and the Monroe County Emergency Management Operations. While all of us are tired of COVID and many of us can move on in many ways in our lives, our COVID staff is still working around the clock on new and expanded vaccine clinics, new and expanded testing sites, and new and expanded ways of getting rapid testing into our schools and across the community. They are working nights and weekends to help end this pandemic. So for me personally, on behalf of our community, thank you to our Monroe County team at the Health Department, Emergency Operations team, and all the volunteers and other agencies who have been involved in our response. You have gone above and beyond. And on behalf of our community, I just want to tell you how grateful we are for your work and your support. Now let's start with the numbers before we get some updates on recent initiatives. Today, we're reporting 224 new cases with a 7-day average of 191. Last week, we had reported 228 new cases and a 7-day average of 201. Per the CDC, Monroe County remains an area of high COVID transmission, but our numbers continue to stay level, which is encouraging. And in fact, our 7-day averages have somewhat decreased over the past couple of weeks. Our vaccination numbers continue to increase, but we are not letting up our plans to push to vaccinate and protect every eligible resident of Monroe County. Last week, we announced a $100 incentive for people to get the full COVID-19 vaccination series in clinics where we have lower vaccination rates. Gift cards in increments of $50 and $100 are distributed on site at the time of vaccination. What's available is a $50 gift cards for both the first and second Pfizer and Moderna vaccines, and $100 in gift cards for the single-dose Johnson & Johnson vaccine. I'm optimistic about this initiative so far. We've had nearly 200 people come out at the eligible clinics since Saturday to get their vaccination thank you gift card. And that's nearly 200 more people who made the right call to protect themselves, their families, and their loved ones by getting the vaccine. The County Fleet Center on Paul Road is now on the list of eligible sites providing gift cards at the time of vaccination. And we're ramping up efforts to get the word out about this incentive program with outreach, social media, advertising directed to focused areas. This incentive runs until November 23rd or until funding runs out. And remember and remind you that these incentives are brought to us through grant dollars through the federal government. And we want to thank them for providing that funding. You can find participating vaccine clinics by visiting the Finger Lakes Vaccine Hub website or by calling 211. To update our vaccination numbers, Monroe County stands at more than 508,000 doses of COVID-19 vaccine administered, with more than 80% of our adult population vaccinated. Now, I say this every week, to help us end this pandemic by protecting yourself, your family, and friends with a safe and effective COVID-19 vaccine. Last year at this time, we saw a dramatic spike in infections. We have Halloween, Thanksgiving, and many family events that will now go indoors as the cold weather approaches. There is no better way to protect yourself, children, parents, and loved ones than getting vaccinated. To update our efforts for pediatric rapid PCR testing, we're getting a brisk traffic at our testing site at the Fleet Center for local K-12 students. As of today, we have administered roughly 400 rapid PCR tests with just 12 positive results. So what that means is that hundreds of students are now back in their classrooms much quicker because they got their test results in hours, not days. The Fleet Center also expanded testing capabilities, and we can now run up to 70 appointments per day. Last week, we reported that we had purchased 100 PCR rapid test devices for our area schools. As of today, I'm happy to report that we've distributed 91 testing kits plus testing cartridges to 20 school districts and some private schools across Monroe County. We have additional test cartridges in stock to resupply schools as they need them. And we're still expecting a few remaining districts to pick up their kits, and we're in the process of ordering additional kits for our schools to further expand these testing capabilities. Also, you may have read yesterday that New York State released new guidelines for local departments of health and school districts to consider regarding testing and quarantine requirements. The County Department of Public Health is evaluating that guidance, and Dr. Mendoza will speak more about that in a few minutes. But finally, before I turn it over, I want to talk about boosters. We have been offering the Pfizer booster shots for a while now, but beginning this Saturday, we will be offering at our county clinics Pfizer, Moderna, and Johnson & Johnson booster vaccines. The Pittsford Plaza site will be offering all of the boosters vaccines on Saturday. On Sunday, our Edgerton site will offer all boosters, and next week, all of our sites will offer all 3 booster vaccinations. Appointments are recommended to be sure we have a sufficient supply and staff at our sites. As for who is eligible for the boosters and the rules around receiving the different vaccines, booster shots of Pfizer and Moderna are available for eligible individuals 6 months after their second dose. Eligible people are those who are age 65 and older, as well as those who are age 18 and older, who live in long-term care settings, have underlying medical conditions, or who live or work in high-risk settings. Examples of workers in high-risk settings include first responders, people who work in congregate care settings, school staff, and people who work in public settings, like grocery stores or public transit. Booster shots of Johnson & Johnson are recommended for individuals age 18 and older and who were vaccinated 2 or more months ago. Eligible individuals may choose which vaccine they receive as a booster dose. CDC recommendations now allow for mix and match dosing for booster shots. So with that, I'll turn this over to Dr. Michael Mendoza.
Good afternoon.
Can you hold
Thank you,
on
County
one
Executive
second?
Bello.
Sorry, Dr. Mendoza, I think there's an issue with who is appearing on screen. I think they're working on it, but right now it appears the interpreter is pinned.
Or should I go ahead, or did you want to wait?
Wait 1 second, please. I'll let you know. Looks good to go now.
Thank you. Good afternoon. Thank you, County Executive Bello, and thank you again to the members of the media who have joined us here today. I know many of you are aware of the memo just released by the New York State Department of Health regarding testing and quarantine of students. We have been following reports and the early scientific literature on this for some time, and I have asked my team to take a look at this again in light of yesterday's memo. In the meantime, I want to touch on a few key points. First, nothing has changed at this time, and most of the items in the memo are not actually recommended at this time by the State Health Department. So first, I've asked my team to consider this information from a public health and a science perspective. Does it make sense from that perspective, and why or why not? How might it affect our local transmission rate, which, as we know, is not as low as we'd like it to be? We also have to consider the practical aspects. For example, if testing needs to be done before school, as the document suggests, is that something all schools can do? Will this work for all students across the county? So we need to work with our partners in education and their parents and get their input before making any decisions. We not only need to get input, but we also need to get consistent buy-in at schools across the county, because any changes would need to be implemented at a county-wide level. Individual schools are not in a position to make these changes at this time. I also want to clarify that the term test to stay does not describe what we are doing currently with the rapid PCR testing machines. Test to stay applies to unvaccinated students who are in quarantine because they were in close contact with an infected individual. Test to stay would allow unvaccinated kids to keep coming to school even while they are quarantined outside of school. I also want to point out that we recognize the presence of masks and look for 15 minutes of continuous physical contact to determine who is under quarantine. Other counties do not do this, and therefore we are quarantining fewer individuals per case than in other counties. Again, this is something that schools and staff and families need to weigh in on, and because this would need to be a county-wide decision, we have to come to some sort of consensus that everyone can be comfortable with. So to be clear, this is different than what we are doing now. We do not currently use the rapid PCR tests on students who are in quarantine. Students in quarantine currently cannot test out of quarantine, not even for the school day. They need to quarantine at home and be released by the health department in order for them to go back to school, but they do not currently require a test in order to do so. The machines that we are now using widely are used simply to allow kids with no known exposure to get back to school faster if they were feeling sick and are now feeling better. The schools can now test them and let them return to class more quickly and more efficiently. So with that, I'm going to turn it back over to Julie for any questions.
Thank you, Dr. Mendoza. Our first question will come from Spectrum. If there's a reporter here from Spectrum, I'm not sure. Doesn't look like there is, so we're going to move on to Raquel Stephen from WXXI.
Yes, thank you, Julie. Good afternoon, County Executive, Dr. Mendoza. My question is in regards to a lot of people are getting really, really sick and is not COVID related. Everyone is testing, COVID tests are coming back negative. What can we say? Is there a really bad cold coming on? Is this the flu? What are we seeing? What are flu numbers looking like? And in comparison to these COVID numbers?
Well, the flu season has begun. The flu numbers are very, very low at this time. So, we don't consider this to be a major source of illness at the moment. But we are seeing, as is typically the case in late October and into the fall, more of the routine upper respiratory infections. So these viral infections are the ones that we see on any other year. And we anticipate that those are what we are finding circulating in the community at this time.
And you said that 20 school districts in the county have received these rapid PCR test kits, correct? Are there, okay. Is there a district that opted out of receiving anything?
I'd have to consult with the list. There are districts that have not yet gotten theirs, but I don't recall any who have said no. Many of them are still working on the plans to take them in, but we could provide a list for you at another time.
Yeah, I believe that's correct. Yep.
Thank you, Raquel. I believe we have Eric Cost on from WROC.
We are not permitting test to stay at this time, and either the state is not recommending test to stay at this time. We're looking into the science of this, and we're going to be talking to the school districts in the coming days to see what their thoughts on the matter would be. But again, this needs to be something that is implemented countywide, and we're certainly not in a position to know that this is something that's desirable countywide. All the above. We don't tend to limit ourselves by the logistics out of the gate. We want to look at the science first. The science seems to be solid, but the logistics are going to be daunting. So I've asked my team to look again at the science, look to see if there are any additional reports beyond those that we've been looking at for several weeks now. To clarify, the rapid antigen test would be permissible here, so we wouldn't be looking necessarily at having to wait half an hour like we would for the PCR test machines. But the logistics and needing a consensus across the community really are the two major points that we need to address going forward.
Thank you. Go ahead.
School nurses are working very hard to keep up with the demand. There's no question that the pandemic has placed an additional burden of work on school nurses and nurses across all settings. They're absolutely right. We're working with them to try to alleviate any of the burden that testing might introduce. We have funding to support testing, If schools are in a position to hire additional nurses, they are welcome to do so for the purposes of supporting the testing effort. But the fact of the matter is that there aren't that many nurses who are sitting around not doing anything right now. So the workforce really is a challenge at this time, and it's been a challenge even before the pandemic, and it's only made worse as a result of the pandemic.
Thank you. Next up, we have, even though it says Jennifer Lukey, I think it's Jennifer Mobilia.
It's Jen Mobilia. Thanks, guys. Hey, I got 3 quick questions. First of all, can you tell me how many fully vaccinated people have died of COVID or COVID complications here in Monroe County?
That's a number we'd have to get back to you on, Jen.
Okay. My second question is on the county's dashboard, there is a graph that shows the cases among school-age children by week. It is broken down to 12 to 18-year-olds and then 5 to 11-year-olds. The trajectory basically is the same. It goes up the same and down the same. But the 12 to 18-year-olds a lot of them are vaccinated, where the 5 to 11-year-olds clearly are not. So how do we explain that?
Well, there is an element of accuracy that's questionable with these. We know that a lot more people are taking tests at home. And so we're not sure that we're getting all of the reports. And this is true. This was true before. So there is a question as to how complete those data are. But otherwise, the numbers are what they are. Our numbers as a county are not coming down as quickly as I would like to see them, and certainly not coming down as quickly as other parts of the country are. We have traditionally been last into these surges and last out of these surges. But it just underscores the reality that there are still a number of, 12 to 18-year-olds who are not vaccinated. And it's those people who we think are more likely and are getting COVID more commonly.
With the holidays coming up, do you have any concerns or advice? I mean, because that also impacts schools, depending on the transmission rate.
My advice hasn't changed. We need to get anybody who is eligible to be vaccinated the vaccine. Those who are vaccinated, hands down, are much less likely to get COVID-19 infection and much, much less likely to have serious complications from it. As we look ahead to Halloween, again, I want to emphasize that the most likely area for transmission would be small indoor gatherings, particularly with people outside of your household, as we know is common around Halloween. So if you're coming in from trick-or-treating, we ask parents to keep an eye on their youngsters, wear masks indoors if there are people from outside of the home visiting. Outdoors is more safe, less likely to transmit. Certainly if people want to wear their mask, they're welcome to. But we want to emphasize indoor, particularly those who are unvaccinated, as is the case at this time for anybody who's 11 and younger. We want them to wear their masks indoors.
Thank you so much.
Thank you, Jennifer. And we either have Dan Schreck or Jane Checco on from 13 Lamb.
Hi, it's Jane. I wanted to ask about the test to stay. I know the county is considering it, but Dr. Mendoza, you said not many kids are in quarantine. Since it's a different way we quarantine kids here. I guess just evaluating the need for test to stay, can you talk a little bit about that and what we're looking for from schools to implement this?
Well, to clarify my point earlier about quarantine, we use a more stringent requirement to quarantine. And so we are going to quarantine on average fewer individuals than a county who uses a more lax definition of quarantine. We look for 15 minutes of continuous contact time. There are other counties that look at 15 minutes of cumulative contact time throughout a day, which, as you can imagine, would enroll more people into quarantine, all other things being held equal. And so in general, we want to quarantine as few as we need to, but we also want to make sure that we keep people healthy and safe. So the logistics of this would, first of all, ensure that we need to ensure that every school who wants to enroll in this has the ability to do all of the testing that they need to in order to return these kids back to school. The idea of testing to stay in school is one that we all like in principle, but the reality is that we have to make sure it works in practice.
Thank you. And my other question is about the Pfizer vaccine once it's approved for 5 to 11-year-olds. Can you share any ideas the county is discussing in distributing this to that population?
Sure. So we have been working with a collaboration with pediatrician offices that are both within both hospital systems, both healthcare systems, and those who are unaffiliated, to be able to provide supports to hopefully be able to offer most vaccines for that age group within a doctor's office setting with a pediatrician. With the idea really being that the best location for a child that age to receive a vaccination would be with their pediatrician in their pediatrician's office, as opposed to one of these larger vaccination sites in the community. It would also be another way for children to, again, come in contact with their doctor and be able to see their doctor. So what we're looking at is different ways that we could support those operations through both through a personnel support and other types of logistical support and administrative support for each one of those offices so that they can, again, get those kids into their offices. So we'll have more news on that next week and what that exactly looks like. But we're hoping to be able to create that model and support system to really encourage these vaccinations to take place in a pediatrician's office setting.
All right, thank you. Our final question today comes from Patty Singer with Minority Reporter.
Hi, I'd like to get some clarity around contact tracing and who is getting followed. How does vaccination status play into contact tracing throughout that contact tracing period?
So again, this hasn't changed, but individuals who are vaccinated do not need to go into quarantine. They would need to wear their masks indoors, as we've been recommending all along, and they can test out of that, needing to wear their masks continuously at day 4 or 5 following their exposure, but they would not be under formal quarantine. An unvaccinated individual obviously would be under quarantine.
Okay, so just to clarify that, and then Julie, I have a separate question for another topic, but just to clarify, so the contact tracing, when someone is at a site and you said that there's been, there's potential for exposure. So someone who is vaccinated, who has that potential exposure, then are they followed as closely? Is there that monitoring? Are they constantly getting the phone calls? How's that really working for someone vaccinated versus unvaccinated? I'm just not clear on that.
Right. So at the initial point of contact, we need to determine and verify that they are in fact vaccinated. And if they are vaccinated, then we don't need to have any continuous monitoring of them because they're not under quarantine. This would only apply, of course, to anybody who is asymptomatic. If they are symptomatic, then we would quarantine them and proceed from there. But we still have to make initial contact with all these individuals to determine their vaccination status.
All right. Just second topic here is, how have the current incentives, the success or the results of the current incentives stacking up to previous incentive efforts?
I couldn't hear you. Patty, can you say that again?
What's the comparison between the current status of incentives, how successful they are, versus some of the earlier incentives?
Well, we only have, I hear you, Patty. We only have one weekend so far of data, so it's hard to really judge that. So we had about 200 people come through those county sites in those designated areas over the weekend who received those incentives. The program again goes through the 23rd of November. So I would wait a couple more weeks just to see how that compares to the previous. We've only had them for a few days at this point, so we want to give it a little bit of time.
At some point, will the county be supplying with the data with the different types of incentives and how they work?
Oh, sure. Yeah, I mean, this is something that we looked at too, like what was effective from previous incentives versus this one. And this is what turned out to be one of the most effective ways of getting people in and kicking off that conversation about vaccine, the right type of incentive. There's different incentives offered by different organizations throughout the year. The United Way, through its generous donations and donors, came onto this $100 level of incentive back at the end of August into September. And that one really, I think, showed the greatest success rate over the course of when that was offered. And that's why we chose to use that level for this next round of incentive that we're in now. So obviously we'll evaluate that as it goes on and see what works and what doesn't work. I mean, at the end of the day, the goal is to get as many people vaccinated as possible, right? And so we're going to do whatever it takes and and really work with everybody to try to get that done, make it as available as possible. And we obviously are reevaluating as we go, but we're happy to share that with you at some point when we have some data to look at.
Thank you.
You're welcome.
All right, thanks, everyone. That's all for questions.
All right, thank you so much.